Emage has been manufacturing the Cytopen microneedling device for about 8 years now, and we introduced a lot of innovations in the microneedling industry. So Doctor already explained a lot about what microneedling is. Microneedling is collagen induction therapy. So we have 12 33 gauge stainless steel needles that make perforations into the skin, cause microchanneling and injury, and then the body responds by releasing cytokine proteins to the cells that signal the cell to regenerate. So we want to stimulate the fibroblasts in the epidermis and the dermis. So that's what collagen induction therapy is. It was also explained about the stratum corneum, why we don't get significant absorption of our serums, because the stratum corneum is a barrier. So microneedling creates microchannels that allows serums, PRP, whatever you're going to be using to penetrate into the dermis to get the effects that we're looking for. I want to talk generally about microneedling pens. There are other good ones on the market. A couple things to look for. One of the biggest things that people ask me, and where the confusion is, Lonnie, I see pens at all kinds of different prices. Why can't I just go on Amazon or eBay and get one at a fraction of the price? It's needles that go back and forth. That's the question we always hear. There's a lot to that. Number one, are the tips, things to look for. Our tips are scalloped. What that means is when you're using a sweeping motion, it doesn't act like a windshield wiper. It's not going to sweep the serums out of the way. Number two, our tips are surgical stainless steel. These inexpensive tips are made of nickel. Many people can't even wear nickel earrings. Why would you use nickel and penetrate their skin with something that could get a reaction? And thirdly, we have a port, a little hole in the side of the tip. Now what happens when these needles retract, it creates a vacuum. When you get a vacuum and you have even any kind of lax skin, you vibrate the skin, so you're not getting penetration. So whatever pen you're looking at, you may want to consider, does it have scalloped edges? Does it have a port? Is it surgical stainless steel? And lastly, make sure it has the power and the torque to actually give you penetration. We hear often, oh, Lonnie, your pen goes to 2.5, mine goes to 3, I use 3 all the time. Yeah, but are you getting bleeding or punctate bleeding? No, because the inexpensive pens, they just bounce on the skin and don't give you penetration. So Cytopen's a good pen. There are other pens out there, but those are some things to look for. So now we're going to do a technique of microneedling. We're going to be using the stem facial growth factor serum. The main ingredient here is mesenchymal stem cell cytokines. As you know, that's the biosignaling protein that signals the cell to regenerate. So this has the biosignaling proteins as the main ingredient. We're going to do quadrants. Now this isn't a roller ball, so it's just going to roll on. Of course, optimally would be supine, but here we're in a chair, but we'll work around that. Where do we set the pen? How deep do we go? The answer is whatever it takes. We're looking for an endpoint, like a laser. A minimum endpoint is going to be erythema. That's going to be a good endpoint. But if we're treating individual rhytids, if we're treating scarring, then we want punctate bleeding. So whatever it takes to get punctate bleeding, that's how deep we go. So we're going to start here at 1 millimeter. Now we're using a sweeping motion. How's that feel? Good. All right. we're going to go horizontally, we're going to go vertically, and then we're going to cross-hatch. You can see we're starting to get erythema. And this is at 1 millimeter, guys, or providers. Okay, so again, we keep the pen moving, and we're using the serum, we're infusing it, and we're using it as a lubricant. So you can see how easily the pen glides using the serum. Now, he does not have a glabella righted. Most people do, and that's where we're going to use a deeper penetration and a stamping motion. When you go over 1.5 millimeters, generally speaking, you want to use a stamping motion instead of a gliding motion. Okay, you can see we have nice erythema, little bit of punctate bleeding. It's a good treatment for what we're doing here. Now, we do have some acne scarring here on the cheeks. We're only going to be treating these cheeks, the cheek area. We're going to increase the depth to 1.5. It's because of the torque. This is what I was talking about. You don't get this with every product. There are other good pens out there, but this is one of them. We want to break up that fibrous tissue.
Okay, so they want to know what is the patient feeling, if you could ask him that.
Ryan, how's that feel?
Good. It feels like I'm shaving my face.
He says it feels great.
Yeah. Doesn't bother me.
You see, I'm using a stamping motion or technique. Now, we can also taut the skin if you need to. Okay, so this is for demonstration purposes, so I think you get the idea. So we're going to go to the other side. The whole treatment would normally take about 20 minutes. I'm actually going to increase a little bit, 1.7. Remember, the dermal epidermal junction is about 1.5 millimeters. So we want to reach the dermal epidermal junction to stimulate fibroblasts to create new collagen. One area of caution is under the eyes. And I would not do more than maybe 0.5 millimeters under the eyes. Also, be careful of the décolleté because it doesn't have the sebaceous glands that you have on the face, and we don't get the same amount of healing that we do on the face. Who can we do microneedling on? Is there any limitation? Any skin type, because we're not using heat. We are not disturbing the melanocytes. There should be no PIH. Of course, and I'm sure in your training manual, you want to wait a minimum time after use of Accutane. Some people say 6 months. Some say a year. Doctor, I'm not sure what you would...
6 months. Yep. As long as the acne is not active, yes. If it's active, then you need to treat with antibiotics and antibiotics. They're asking about the treatment of acne, so the answer is as long as it's not active, you make sure that if it's active, you treat it with antibiotics, and then you go in and treat with this after you have treated it with your antibiotics. With hospitals that they have active hospitals.
Okay, I'm just going to show you briefly how to treat under the eyes, and you want to taut the skin.
Now, you lower the vesicle penetration rate.
Yes, we're at, now we're at 0.5 millimeters. You want to taut. So the sensitive areas are the upper lips and the nose. You also want to taut the nose. And it does tingle. It makes them want to sneeze, but they don't. I'm now at 1 millimeter. You can see we're getting nice erythema, a little bit of punctate bleeding. That's good. That's all we need. Of course, we will also do the neck. He has a beard, so I'm probably not going to microneedle over the beard. So for demonstration purposes, I think this will give you an idea. What questions do we have? Responds extremely well is Strea. If they're less than a year old, they respond very well. If they're decades old, it's a little more challenging, but it's maybe the modality of choice for stretch marks. Strea stretch marks?
How much pressure do you apply to
Yeah, actually, I was applying very little pressure. As you can see, it was not really, so just enough to keep it steady.
She has a question for you. So, calling it a red carpet facial, patients are going to ask, how long until they can apply their makeup? What does that look like? Do we on Friday? On the weekend?
Yeah, no, that's their trademark. Our trademark is the stem facial, and we allow you to use our trademark. So keep in mind, you're not competing with microneedling on Groupon. We're not doing microneedling, we're performing the stem facial. Everything post-care, there's a post-care instruction sheet that comes with the kit. We don't want any makeup until the next day because we want those, we want the perforations to resolve. We don't want them exercising and sweating profusely. We don't want them, now they can wear makeup the next day, and we want them out of the sun completely for the first 24 hours because we've removed the stratum corneum that's going to protect the dermis from UV radiation. And all this is in the kit, complete instructions from A to Z, how to do the stem facial, post-care, pre-care, contraindications, everything that you need. We have 7-day-a-week customer service if there's any questions.
Guarantee on the phone?
The pen is, thank you for that, it's 2 years.
Is it best not to do if there's any facial hair of any sort?
You can, but it's a little bit more challenging because it'll try to break the hair. But of course we do microneedling for hair regeneration, using PRP, and that's another use of a microneedler.
Do that stamping.
You will use the stamping motion because you don't want to break the hairs.
The what motion?
I'm sorry?
The what motion? What did you just?
Stamping motion for the scalp instead of a sweeping motion for hair regeneration.
Well, thank you so much. We appreciate it.